everyone. Happy morning, a very good morning. I hope and I believe all of you are doing well. Please a quick note whether the audio visual is good. Is the audio good, guys? Everyone is able to hear me? Okay, that's great. So today we are going to discuss again the confusing topics because that is what our task is, to simplify the difficult topics. And actually they are not so difficult. So we'll try and simplify this topic today of the venous system development. We look at the development of the important veins, and actually, it's very easy to remember this topic. I'll tell you how to remember, and then towards the end we will see the previous questions that have been asked on this topic as well. Okay. So why are we doing this today? Because of the new timetable that we started yesterday. All the NEET PG 22 candidates, you can follow that timetable. We have the classes in sync with that every day. We have a pre-test, we have a post-test, right? Pre-test at 10, post-test at 9 p.m. And basically it's to keep you accountable for your daily targets, to keep a check on you. Okay, thank you so much, Manim, for that. Uh, Okay. So Nikunj, anterior is heat and posterior is cold. I mean, read the question carefully. Maybe you can just share the screenshot of the page that you are talking about. So response to heat. Okay, response to heat it is the anterior nucleus of hypothalamus. So basically the anterior nucleus generates the heat. So read the statement very careful. I'm very sure that there is some misreading that has happened there. I would really like to see that page so that even I get that assurance that whatever was discussed was correct. Okay. So if it is posterior, posterior basically is response to cold. That means in the cold we generate heat in the body. So the posterior generates the heat. That is what must have been happened. Is that right, Nikunj? Anterior is response to heat. That means it decreases the temperature. Posterior increases the temperature because in cold you want to increase the temperature. Okay. All right. So let's discuss this topic of the venous development. Before that, the plan for the day that we have. Okay. The plan for the day that we have is 10 a.m. we will have the pre-test of anatomy. I'll share the link on the Telegram group, Dr. Nikita's Radsynapse. 5 p.m. we have the Unacademy free life class, the special class, where like yesterday we discussed, we are going to discuss many other mnemonics in anatomy. If you have not checked the diaphragmatic opening car mnemonic, check that. The details of that would be discussed in the 5 p.m. class as well. Then 9 p.m. we will have the post test. Okay, 9 p.m. we will have the post test. All right. Yes, a reminder for me, the plus classes that I have taken on Unacademy for anatomy, which include a quick review of embryology, which includes the dermatomes, which includes a part of upper limb, the brachial plexus, the type of joints, the type of epithelium. There are quite a few other topics. I'll share there. Okay. Yes. So Madhu, we'll do the best that we can in the upcoming days. We will definitely have like image-based KBMDs as well, dedicated to the images. Okay. All right. So a pre-session question here for all of you. Let me see how many of you get this one right. So all of the following veins are formed from vitelline vein except Madhu. We have already started the revision on the Unacademy special class, the rapid revision sort of thing. Okay. हाँ, post test telegram में I share the link. It happens on the Unacademy app. It's free for everyone. All of the following veins are formed from the vitelline vein except which of the following? Very good. So Varun has got it right the first, and that is your superior vena cava. I'll come to this question later on as well. Okay, this why superior vena cava is the answer here. Let's quickly have a look at this topic. So to begin with, you need to know the you need to know the fetal circulation very well. You know how exactly is the fetal circulation, then we will know the veins development. So basically we have the placenta, the blood to the fetus. The fetus is dependent on the mother, right? So the blood, the oxygenated blood is carried via the umbilical vein. From the placenta, the umbilical vein carries the oxygenated blood. Please remember that. So the two veins in the body which carry the umbilical or the oxygenated blood are two veins which carry oxygenated blood are, otherwise veins are deoxygenated. One is umbilical vein and the second one, which is the other vein which carries the oxygenated blood. One is umbilical and the second one is, yes, it is the pulmonary vein, right? It is the pulmonary vein. Now, what do we see here is you have the umbilical vein. Okay, you have the umbilical vein. How many umbilical veins are there? There are two umbilical veins. Which one regresses? Remember the mnemonic R for R, right regresses. Okay, R for R, right regresses and left is left. Okay, so you have left umbilical vein which persists, the right regresses. So basically if I ask you that in the umbilical cord, this is a very important question. How many arteries and how many veins? Remember it is 2AV, that is 2 arteries and 1 vein. Okay, so 2AV, that is 2 arteries and 1 vein. Which vein is it? It is the left umbilical vein. And what does it form in the adult? What does it form in the adult? What is the remnant of the left umbilical vein? What is the remnant of the left umbilical vein? Yes, absolutely right. It is ligamentum teres. Okay, it is ligamentum teres. That is the round ligament of the liver. Okay, so very important question. All these are the important questions that can come in your exam. Now, after that, what do we see? The umbilical vein is here, and you have ductus venosus. What is ductus venosus connecting? What does ductus venosus connect? So like you see in this diagram, this ductus venosus basically connects the umbilical vein to the IVC. Okay, it is a connection between the umbilical vein and the IVC. Very, very important. Then the blood goes to the heart, the right side may, then through the foramen ovale, it goes to the left side, right? And then you have going to the body, okay, going to the entire body. And then the blood goes to the entire body. You have deoxygenated blood. The fetus has utilized the oxygen. The deoxygenated blood is carried by the umbilical arteries, right? The umbilical arteries carry the deoxygenated blood. Very, very important. And what is the remnant of the umbilical arteries? What is the remnant of the umbilical arteries? It is your medial umbilical ligament. Okay, remember it is your medial, not the median. Please remember it is the medial umbilical ligament. It is not median. Median is urachus. Left umbilical vein is ligamentum teres and it is oxygenated. This is deoxygenated umbilical artery. So another point to be remembered, remember that umbilical arteries remnant is medial, not median umbilical ligament. Okay. So that was about the fetal circulation in a quick review. Now going to the major venous drainage. Okay, the major venous drainage into the heart that carries the blood. You have the sinus venosus, the right horn and the left horn. Okay, the right horn and the left horn of the sinus venosus. Now each horn of the sinus venosus basically receives the blood from the three veins. You have C, U and V. That is the cardinal vein, the umbilical vein, and the vitelline vein. Okay, the cardinal, umbilical, the common cardinal, umbilical, and the vitelline. Now the cardinal veins basically carry the venous drainage from the body wall. Umbilical, we said only the left is there, which is left, the right regresses. And the vitelline vein basically carries the venous drainage from the yolk sac. So remember, body से basically जो आता है B के बाद आता है C, it is the cardinal vein. From the yolk sac, V and Y are very similar, right? V and Y. So from the yolk sac, it is the vitelline vein, okay? So the next point to be remembered, that from the body wall, basically it is the cardinal veins. You have anterior, posterior, and they join to form the common cardinal. From the yolk sac, the venous drainage, yolk sac is basically V. Remember, it is the vitelline vein. Okay, that is the vitelline vein. Now, after that, I hope all of you can see this. So you have the anterior cardinal vein. Remember, basically drains the superior part of the body. So this is the anterior cardinal vein. Niche you have the posterior cardinal vein. They both join to form the common cardinal vein. Okay, they join to form the common cardinal vein. Then you have the vitelline vein, which is surrounding the duodenum, and you have the umbilical vein. Okay, I'll share the PDF of the yesterday class. I forgot that, and today's class as well. Okay. All right. Now going to the next one. So when you have the development of the portal vein, if I tell you quickly, it's basically the vitelline vein which predominantly contributes to your portal vein. Now a very, very important point to be remembered here, the quick tricks that we have to learn. So basically your venous drainage related to the liver. Okay, related to the liver, you have the portal vein. What is portal vein formed by the union of? What is portal vein formed by the union of? You have the splenic vein which comes from the spleen, and you have the superior mesenteric vein, right? So splenic vein and superior mesenteric vein, they unite to form the portal vein. Now where is the inferior mesenteric vein? Inferior mesenteric vein generally drains into the splenic vein, right? Here you have the inferior mesenteric vein. So all these veins, and even in the liver, your hepatic sinusoids, okay? Even in the liver, the hepatic sinusoids. So everything related to the liver, the portal vein, their tributaries, all of these, they develop from the vitelline vein. Okay, all of this, they develop from the vitelline vein. Is this clear with everyone? So remember, vitelline vein is related to the liver and aju-baju ka. The hepatic sinusoids, the portal vein, the splenic, the SMV, and the IMV. Anything else you can remember that vitelline vein contributes to? Anything else you remember that vitelline vein contributes to? So you have a major vein basically which is draining the body, and it goes through the liver also, and then it goes through the right atrium, right? Then it goes to the right atrium. So this part through the liver, we have this as well, which is the hepatic segment of the IVC, right? Very good. So very good, Janki. So the hepatic segment of the IVC, again related to the liver, that is from the vitelline vein. So remember that the superior most part of the IVC is from the vitelline vein. Okay, that's from the vitelline vein. Now that was about the vitelline. If I ask you, portal vein predominantly is formed by right vitelline vein or left vitelline vein? The general rule that we have the veins on the right side, right? The veins, the superior vena cava, the inferior vena cava, they drain into the right atrium. So remember that veins are present on the right side. In the fetus, there happens a shunt from the left side to the right side. So the right-sided veins are what develop. So predominantly, it is the right-sided veins which contribute to the venous drainage development. Is this concept clear? So remember that the veins are on the right. Even in anatomy, if you see CT scan images that we see, if you have this CT image of the abdomen and you have the two structures here, okay, you have the two structures here. Imagine this is a CT image. Okay, this image that we are seeing is the CT image. So this is the left side of the patient. In radiology, it's the opposite. This is the right side of the patient. So what is present on the right side is the IVC. What is present on the left side is the aorta. So remember that veins are present on the right side. So generally it is the right sided veins which develop, contribute to the normal venous development. Okay. We'll come to the pathologies, when it is double SVC. Okay. Now think logically, even if you don't know what does SVC develop from, but if I give you the option, the two options that you have, double SVC is due to persistence of right anterior cardinal vein, or is it due to persistence of left anterior cardinal vein? Just take a logical guessing on what we have discussed so far. Double SVC would be due to persistence of right anterior cardinal vein or persistence of left anterior cardinal vein. Double SVC means right is also present and left is also present. So normally the one from which the SVC would develop is the right side. The left side is the one which is abnormal. So basically it is the persistence of the left side because right is normal, right? Now we will see that from where the SVC develops, okay, from where the SVC develops. So what we have basically is from above, coming from above, you have the anterior cardinal vein. Coming from below is the posterior cardinal vein, and they both unite to form the common cardinal vein. And this common cardinal vein, we said it drains into the sinus venosus, right? It drains into the sinus venosus. So anterior is draining from above. So basically this is what will contribute to your SVC formation. Okay, this is what will contribute to your SVC formation. The anterior and the common cardinal. Okay, look at the image. So you will have the anterior and the common cardinal which will form the SVC. Okay, and the next one, if I tell you that this part, okay, think logically and tell me, you'll be able to answer. This part of the anterior cardinal vein will lead to development of which vein? This part, if this is the SVC, right? This part of the anterior cardinal vein will be what vein? This part of the anterior cardinal vein, the right anterior cardinal vein will be what vein? What drains into the SVC basically? Right. So coming from upper, say head and neck, say it is the IJV, and then you have your subclavian vein, right? So IJV, brachiocephalic vein, is what will be formed here, and you have the left-sided brachiocephalic vein coming here. You have the IJV coming. So basically, what you have in the superior vena cava, you have this left brachiocephalic vein, you have the right brachiocephalic vein, you have the left-sided IJV, right? You have the left IJV. So basically, this is left IJV, this is the left brachiocephalic vein. This is the anterior cardinal vein. As you can see, this is the anterior cardinal vein. So think logically and tell me that the left brachiocephalic vein, from where it is developing? This is the anterior cardinal, this is the anterior cardinal, right? From where is the left brachiocephalic vein developing? The anastomosis between the two anterior cardinal veins, right? The anastomosis between the two anterior cardinal vein is what is forming the left brachiocephalic vein. Is this clear with everyone? Is this concept? So if you know the anatomy, basically you can derive the development, right? So basically you have the IJV, right brachiocephalic, left brachiocephalic, IJV. You have the superior vena cava, and then you have the right atrium. Okay. So this anastomosis, this is the left brachiocephalic vein. This is the left IJV. You have the right IJV. You have the right brachiocephalic vein, and you have the SVC. So all of this anterior, and then you have the common cardinal vein here. Clear with everyone? This is regarding the development of the SVC. Okay, this is regarding the development of the SVC. Now, if there is left-sided SVC, let us see the next diagram. Okay, let me take you to the SVC first, then we will see. So look at the diagram here, everyone. Look at this diagram. Okay, so that is what we had drawn. So you have the right IJV, you have the right brachiocephalic vein, you have the left brachiocephalic vein. Okay, then you have the superior vena cava. From where is the superior vena cava formed? This is the anterior cardinal and the common cardinal, right? The anterior cardinal and the common cardinal. Is this understood by everyone? Now, if you have the left-sided SVC, okay, if you have the left-sided SVC, so double SVC, you have right SVC and the left SVC as well, double SVC. So it's basically the persistence of the left anterior cardinal, okay. The anastomosis is not present, that fails to form. The question that you get in the exam is the left SVC, it drains into what? Right superior vena cava is draining into the right atrium. What does the left SVC drain into? That is the coronary sinus. Okay, this is the coronary sinus, then going into the right atrium. So remember, the left SVC drains into the coronary sinus. Coronary heart is present on the left side. So remember, left SVC is in the coronary sinus. Okay. Sometimes that instead of the right SVC, there is left-sided SVC. You can see that this part of the superior vena cava on the right has not formed. So you get the mirror image of what we have normally. So this is the left SVC draining into the coronary sinus, not the coronary artery. The vein is the coronary sinus. Okay, it drains into the coronary sinus. Okay. Coming to the portal vein that we discussed. So if you are asked to identify the vein, suppose you are given this image-based question in your exam and you are asked to identify this vein. Is it the cardinal vein? Is it the umbilical vein? Is it the vitelline vein? So remember that this is the duodenum that we see. The one which is encircling, which is around the duodenum, that is the vitelline vein. Right? We know the portal vein develops from vitelline. It's related to the duodenum. So in immediate relation to the duodenum, remember that's the vitelline vein. You can get image-based question like this. This is the left umbilical vein. You can see this ductus venosus connecting to the IVC. Okay, that's the ductus venosus. Look at how the portal vein is formed here, right? The vitelline vein, which was there surrounding the duodenum. You have superior mesenteric vein, you have splenic vein, then forming the portal vein. All this is from the vitelline vein. Okay, all this is from the vitelline vein. Clear with everyone? The hepatic sinusoids, that is from the vitelline, right? The hepatic sinusoids, everything related to the liver is your vitelline vein. Okay. So this is your duodenum. You have the vitelline vein. You have the anastomosis between them. No need to go into the details. Remember that predominantly it is the right-sided vitelline vein. You have the anastomosis and some part contributing from the left. Right, the most predominant is the right vitelline vein. Okay, SVC we have seen. And now coming to the most important, that is the IVC development. Okay, very, very important, the development of the IVC. Let's start from niche se and then let's go up. So starting from below, you have the posterior cardinal vein. Okay, you have the posterior cardinal vein. What comes above posterior cardinal vein? Someone who has read the venous development, what comes above the posterior cardinal vein? You have supracardinal vein. Then you have the subcardinal vein. Okay, you have the supracardinal, you have the subcardinal, and then you have the liver wala part, that is the hepatocardiac channel. That is basically your vitelline vein that we spoke about. And then you have the right atrium into which the IVC drains. Remember, it is posterior, supra comes pehle. Rather, niche is supra, then is sub, then is the liver wala, and then is the right atrium. If I have to draw this, so if this is the heart, the right atrium, the IVC going into the right atrium, before that, you have the hepatic segment, right? Below the liver, we have the kidney here, right? We have the kidney here. Then we have the niche wala part, okay? And we know the renal veins, they drain into the IVC. Are all of you able to see this? Yes? All right. So you have the renal veins draining into the IVC. So look at the segment here. Okay, look at the segments here basically that you have. The vitelline vein is basically your hepatocardiac channel, like liver से heart तक. उसके बाद में this part that you have, the sub part is what we have written here. That is the one which is at the kidney ka level, right? So the renal vein, this part, this is from the subcardinal vein. Okay, this is the subcardinal vein. Then you have the supracardinal vein, and then you have the posterior cardinal vein. So basically in between you have the anastomosis between supra and sub. You have the anastomosis between sub and the vitelline vein. Okay. So remember that if you look at the image from outside from outside to inside, you have posterior. जो सबसे पहले आता है when you look from outside to inside, जो सबसे पहले आएगा that is supracardinal. जो उसके अंदर आएगा that would be subcardinal. I'll show you the image as well. Okay, so have a look at this image. Okay, have a look at this image. This is the long one that you have, right? You have this long posterior cardinal vein which is joining with anterior to form the common cardinal vein. This one from outside which you see, which is the upper one, this is the supracardinal. The inner one is the subcardinal, right? The inner one is the subcardinal, okay? And then you have the hepatocardiac channel. So you have the posterior cardinal, you have the supra, you have the anastomosis, you have the sub. Again, you have the anastomosis, and then you have the hepatocardiac channel. I mean, it's easy to remember basically. So remember, it is the posterior cardinal, it is the supracardinal, the subcardinal, and the hepatocardiac channel, that is the vitelline vein. These two are basically the anastomosis in between these veins. Anastomosis between supra and sub, anastomosis between sub and vitelline. Okay. So remember, supra pehle aayega because it is above, the above level. Okay. So first will be supra and then will be sub. Okay. So these are the 6 segments. Easy to remember. I don't think it is that difficult. So posterior क्योंकि नीचे से आ रहा है, फिर ऊपर वाला supra, फिर sub, और उसके बाद you have the hepatocardiac channel. So if you see the diagram that we had drawn here, so basically at the level of the kidneys, the veins that you have, the renal vein. What drains into the renal vein? Anyone? What drains into the renal vein? What drains into the renal vein? Left renal vein, you have the gonadal vein going, right? The left renal vein, you have the gonadal vein. The left gonadal vein drains into the left renal vein. The right gonadal vein drains into the IVC. So even the gonadal vein, even your renal veins, this part, the renal part, सबसे बड़ा part of the IVC, this all develop from which part? They develop from the subcardinal vein. Okay, they develop from the subcardinal vein. So like we remembered, okay, so like we remembered that the veins related to liver, from what do they develop? Liver is your vitelline vein. You can remember this as when I write liver, okay, when I write liver, it is your VI, that is your vitelline vein. Easy to remember, right? So if you see in vitelline itself, you have LIV, that is liver wala. The veins related to the kidney, that is the renal vein, the gonadal vein, the part of the IVC, that is your subcardinal vein. Okay, that is your subcardinal vein. Kidney is below the liver sub. Remember, that's the subcardinal vein. Suprarenal is from the anastomosis that's there. ठीक है? So ये हो गया IVC का development. So a quick review here. Postrenal, that means below the kidney, that means below the sub. We had the supracardinal and we had the posterior cardinal, right? Both on the right side, and you have the anastomosis. Renal segment is from the subcardinal, everything from the right because venous system is from the right. Hepatic segment is your hepatocardiac channel and basically the anastomosis. This is basically your vitelline vein, right? That's your vitelline vein. Is that clear with everyone? So we have seen the development of portal vein. We have seen the SVC. We have seen the IVC. Okay. Now just few quick points about the less, the less frequently asked topics, but the extra edge topics. The azygos vein, the superior intercostal vein, and all of that. Okay. So if you remember this image, okay, if you remember this image, the anterior, the posterior forming the common cardinal. Now, basically, this is the IVC, SVC, sorry, this is the superior vena cava we saw that forms. Can you tell me a vein which drains into the superior vena cava? A vein which drains into the superior vena cava from below, from the lower part of the body, that is the azygos vein. Okay, remember that's the azygos vein. So if I ask you that this part, okay, basically this part, this is the posterior cardinal vein, the superior most part of posterior cardinal vein, which is draining into the SVC, because this is the superior vena cava, that basically will form what? What will it form? The azygos vein, the distal part of the azygos vein. In the body, we have the azygos line of veins. This AL that you see here, this is the azygos line. Okay, this is the azygos line which is present. This forms the azygos system, and this part of the posterior cardinal vein, that forms the distal part of the azygos vein. Is this clear with everyone? Okay, so remember the right posterior cardinal forms the part of the azygos vein, right? What does the left posterior cardinal form? What does the left posterior cardinal form? Let me see if I can show you this image. Okay, so look at this one. Here you will have the anterior cardinal vein, you have the anastomosis coming. The left superior intercostal vein, look at this blue color here. The left superior intercostal vein, which is basically, look at this one, draining into the brachiocephalic vein. That is your left posterior cardinal vein. Okay, remember this point. Let me add down to the notes here. What did we discuss? The extra edge points here. The superior most part of the posterior cardinal vein, what do they contribute to? On the right side, it is the azygos vein. On the left side, it is the superior intercostal vein, which drains your second, third, fourth intercostal vein. Okay, which drains your second, third, fourth intercostal. Hemiazygous, accessory hemiazygous, where do they drain? Do they drain into the brachiocephalic? No. Look at this. The hemiazygous vein, from the left, it goes to the right, draining into the azygos. The accessory hemiazygous goes into the azygos. So basically that goes into the SVC finally. The azygos goes into the SVC. Okay. So remember, hemiazygous, accessory hemiazygous are going into the azygos itself. Like you see here, they are going into the azygos. Okay? Clear with everyone? Is this concept clear with everyone? Right? The left sided, you have the hemiazygous and the accessory hemiazygous. Okay? All right. Now let's quickly revise whatever we have learned. So we saw that the three important veins draining into the sinus venosus, you have vitelline, you have umbilical, and you have cardinal, right? Vitelline veins basically drain the yolk sac. How will you identify from the image? Surrounding the duodenum. Vitelline vein, everything related to the liver. So you have the hepatic veins and sinusoids. You have the portal vein, the splenic vein, the superior mesenteric vein, and the inferior mesenteric vein. In the liver, you have the ductus venosus communicating, and it forms the superior most portion of the IVC. Umbilical vein, R for R, right regressus, left is left. It forms ligamentum teres, right? Cardinal vein, anterior superiorly, it forms the SVC and the IJV. Posterior niche, the lowermost part of IVC. Draining into the IVC, you have the common iliac veins, right? So that would be your posterior. Subcardinal is related to the kidney. So renal vein, gonadal vein, IVC. Supracardinal is renal ke niche, right? So portion of the IVC which is infrarenal, okay, which is infrarenal, and contributes to some part of azygos and hemiazygos. Supracardinal contributes, okay, the azygos and the hemiazygos, okay. The final part of azygos would be the posterior cardinal vein, okay. Again, a quick review. Vitelline veins, basically superior mesenteric, hepatic, IVC, and the portal vein. You can also add the splenic vein. You have the inferior mesenteric vein. Right umbilical vein regressus. Left is left, ligamentum teres. Anterior cardinal, SVC and the IJV. Posterior cardinal, niche, IVC and the common iliac. Subcardinal, related to the kidney, IVC, gonadal and renal veins. And you have the supracardinal, which forms the infrarenal IVC, the azygos and the intercostal veins. Okay, so remember that azygos has contribution from the supracardinal, and then you have the uppermost, which is the posterior cardinal. Okay. Now let us quickly see some some MCQs. Posterior cardinal vein contributes to the development of which of the following? What do you think would be the answer to this? Posterior cardinal vein. Posterior, remember, is below, right? Posterior is below. So you automatically rule out the three options even if you don't know the answer. पोस्टीरियर याद रखना, एंटीरियर यानी ऊपर, पोस्टीरियर यानी नीचे. सुपीरियर वीना केवा ऊपर है, आईजेवी ऊपर है, एक्सटर्नल जुगुलर वेन ऊपर है. So the answer becomes your common iliac vein, right? Your common iliac vein. Think logically, guys. This is a question where you can easily rule out the options. This is the above part. So below the inferior part of body, that is your common iliac vein. Okay. Next one, let's solve these questions which have come in your previous exams. The most important structure involved in development of IVC is which of the following? Is it the supracardinal, subcardinal? Is it the umbilical, the anterior cardinal or the posterior cardinal? Right? The correct answer here would be A. The supracardinal, subcardinal. They contribute the major part. Posterior cardinal, a short part is contributed, but that's a very small part. So, right, remember the major is supra and sub. Together, that's the major part. So, please don't go with posterior cardinal. Look at the options. The best option here is your supra and the subcardinal. Look at the options carefully. Okay. Next one. Derivative of vitelline vein is which of the following? Again, look at the options. IVC, SVC, ligamentum venosum or ligamentum teres. Right? It is the IVC. Okay, it is the IVC. So you can remember this again as for vitelline. We discussed the mnemonic, that is vitelline is LIV, that is related to the liver, and also do this IV ulta, that is it contributes to the IVC. Okay, it contributes to the IVC, the hepatocardiac channel. Double inferior vena cava is formed due to persistence of which of the following? Double inferior vena cava is formed due to persistence of. Now remember that this double inferior vena cava, if I tell you that it is most common location for double inferior vena cava is infrarenal location, the infrarenal. Then what will be the answer? We discussed that ki jo renal wala hai, that is the subcardinal vein. Sub ke niche kya tha? Supracardinal vein. Okay, the supracardinal vein. Immediately below the sub part, that was the supracardinal vein. So the best answer here is going to be supracardinal, because remember that infrarenal is very common. Okay? Next question. All of the following veins are formed from vitelline vein except, look at the options, hepatic vein, superior vena cava, IVC, superior mesenteric vein. Related to the liver, the portal vein, and the IVC is from vitelline. So this is superior vena cava, right? Superior vena cava forms from right anterior and right common cardinal vein, right? It forms from right anterior and right common cardinal vein. Left-sided SVC drains into, remember the image, you had the left SVC draining into the coronary sinus, then draining into the right atrium, right? It is the coronary sinus. Again, the same question, double inferior vena cava is formed due to persistence of supracardinal vein. Infrarenal is most common. So remember, it is the supracardinal vein. Okay, the supracardinal vein. Clear with everyone, guys? So, I mean, these are the quick tricks just that you need to know. Ki right-sided veins will develop. The left side would be abnormal. Anterior is the superior part. Posterior cardinal is the inferior part, right? You have the anterior and common cardinal forming the SVC. For IVC, it is posterior, supra, sub, and the vitelline vein contributing. Portal vein is from the vitelline vein, predominantly the right-sided. Everything related to the liver is vitelline vein. Everything related to the kidney is the subcardinal vein, right? Azygos drains into the SVC, that is the posterior cardinal vein will contribute, and you have the supracardinal vein which contributes in the inferior part, right? The left-sided superior posterior cardinal vein that will form the superior intercostal vein which drains into the brachiocephalic. Okay, the left superior intercostal vein. Clear with everyone, guys? I hope this is now easy. Just make this quick notes of the summary that we made basically, right? And then it would be very, very easy to remember this topic. And please solve the MCQs from whatever resource you are using. Please solve the MCQs. I'll see you again at 5 p.m. on the Unacademy app for the free live class on other quick tricks in anatomy that we have to discuss. Okay, simplify the subject of anatomy. Okay, so let's quickly have a pre-test now on the Telegram group. I'll share the link and we'll start the test at 10 a.m. Okay, so goodbye everyone. Thank you. And what is the topic for tomorrow that we are going to discuss? Tomorrow, that is 2nd of February, we have orthopedics, right? So we are going to start with orthopedics. So tomorrow 9 a.m. The quick topic that we are going to discuss is your named fractures. You know, all the named fractures, आपके spine के, upper limb के, lower limb के, everything compiled together. We will quickly revise the named fractures. And 5 p.m. We will have the ortho LMR. Okay, the binge revision of ortho with all the important tables and lists that we need to revise. Okay. So thank you so much, everyone. Have a very, very productive day. See you at 5 p.m. again. Till then, goodbye, take care, and keep studying,